Mr. Johnson. How are you today?
I'm doing pretty good. How are you?
Good. My name is Sam. I'm a student physical therapist.
Okay.
I'm going to ask you some questions related to your history. Is that okay?
Yeah.
All right. So, I see that you're having some mid-back and knee pain.
Mm-hmm.
So, when would you say, we're going to start with your back. So, when would you say this problem first started?
Probably about 2 weeks ago.
2 weeks ago? Okay. And then, how would you describe that pain?
It's kind of like an aching, constant aching pain.
Okay. And then is it kind of on both sides of your back, or would you say more on one side?
I'd probably say both.
Both sides? Okay. And then, so on a scale of 1 to 10, 10 being the worst pain you've ever had, and then 1 being like minimal pain, how would you rate that pain at its best for your back?
Probably 4 at its best.
Okay. And then what about at its worst?
I think I'd probably say an 8. It gets pretty bad, so.
Okay. So what sort of things are you doing when it is at an 8?
Lifting, that is pretty bad, and sitting at my computer or my iPad for more than 30 minutes
Okay.
makes it hurt pretty bad. Anything like twisting movements.
Okay. What sort of things are you lifting?
I work in a factory with packages, so I move a lot of packages.
Okay. Some pretty heavy boxes.
Mm-hmm.
Okay. Is there anything that you would say kind of relieves your back pain?
Changing positions usually kind of helps it get a little less tense. Hot showers seem to help too, and then laying on my side makes it feel better.
Okay. Okay. So you said that your job kind of irritates it. Is there anything else?
Well, just my computer, using my computer, and then sleeping in one position kind of makes it worse. So.
Okay. Can you tell me more about sleeping? Are you able to get to sleep right away?
I can fall asleep, but I just can't stay asleep.
Okay.
So
are you waking up kind of in the middle of the night?
Yeah. I usually make it 3 hours, 3 to 4, and then I just have to get out of bed, move around because the pain gets too bad.
Okay. And so moving around kind of helps, and then are you able to fall right back to sleep?
I can sometimes, depending on the night,
Okay. Let's see. Are you seeing anyone else for this problem?
No, not right now.
No? Okay. Okay. Now, looking at your medications, what medications are you currently taking?
I'm taking hydrochlorothiazide.
Okay. What's that one for?
That one is for my psoriasis.
Okay.
And then I'm taking my asthma inhaler whenever I need it. And then I also have a steroid that I use as needed for the psoriasis.
Okay.
And then I'm taking adalimumab, which is for my hypertension.
Okay. And then did you say you're taking ibuprofen?
I am, yeah,
You
for
are?
my back and my knee pain.
Okay. And then would you say that's helping at all?
I think it does, but it doesn't fully fix my problem.
Okay.
So.
All right. Have you had any surgeries on your back?
No, I've never had any surgeries on my back.
Any x-rays done?
No.
Any other surgeries?
On my back?
Yeah.
No.
Okay. Now, let's talk about your knee pain.
Okay.
So, when would you say the knee pain started?
It's been a while. It's kind of ongoing. I don't really remember a specific start point for it, but it's just kind of always been there.
Okay. Any knee injuries, knee surgeries?
When I was younger, I did have an ACL repair.
Okay.
And they also worked on my meniscus too.
What age were you when that?
I I was 17, so
All right. So on that same pain scale, how would you rate your knee pain at its best?
probably a 4.
4 to 10. Okay. And then at its worst?
It really just kind of depends on the activity, but probably anywhere from like a 4 to a 6.
Okay. And then how would you describe that knee pain?
It's also pretty achy, but it's just dull. Like it's not very bad. It's just always there.
Okay. And this is your left knee, correct?
Yeah, this is my left knee.
Okay. And then would you say there's anything that relieves your knee pain?
Well, changing positions kind of helps that as well. And then I wear like one of those knee sleeves
Mm-hmm.
when I'm doing things, and it seems to help.
Okay. Anything that you can think of that worsens the knee pain?
Mm-hmm. Yeah, going upstairs is kind of hard on the pain, and then it kind of just gets worse throughout the day. Like standing, sitting starts hurting, and then it just gets worse throughout the day.
Okay. Do you use any ice or heat?
No, I mean I take hot showers every once in a while, but
Okay.
I don't actually use any ice or heat.
Okay. All right. Are there any medical conditions that you have that you'd like to know
Well,
about?
yeah, I have hypertension, and then I have asthma, but it's not bad asthma. And then I have uveitis and psoriatic arthritis.
Okay. And then those medications, are you taking those regularly as scheduled?
Yeah, the steroid and my inhaler are kind of an as needed,
Yep.
but everything else is just
You take it as
taken
prescribed.
as prescribed.
Okay, perfect. All right. So during the past year, would you say that your sleeping has gotten worse?
Yeah,
Okay. How many hours of sleep do you think you're getting a night now?
probably I at least get 3 or 4, and then after that it's just kind of shaky. Depends on the night. So
Okay. And then prior to this, how many hours would you say?
probably around 7 to 8.
Okay. So it is 15 there. All right. So would you say your pain is worse at night?
My knee pain is.
Okay. All right. And do you have any other joint pain or any swelling that you've noticed?
Not that I've noticed.
No? Okay. Okay. Do your family members have any medical conditions?
Yeah, my brother has psoriasis, and then my sister has Crohn's disease.
Okay. Any major life changes in the past year?
No.
No?
It's been pretty normal.
Okay. So with your job, are you a full-time, part-time?
Mm-hmm. I am a full-time worker.
Okay.
Still.
So about 40 hours a week?
Yeah.
Okay. And then, do you live with anyone?
Yeah, I live with my wife and our 2 kids.
Okay. And then what type of home do you live in?
We have a single family home.
Okay. All right. Do you have any history of tobacco or current tobacco use?
Yeah, no, I've never done any sort of tobacco.
Do you drink any alcohol?
I do, yeah.
Okay. About how many drinks per week?
I'm not really sure how many per week. It's really just like a social
Okay.
type of thing.
All right. Do you do any regular exercise?
Not really anymore, just working, but
Okay. Is there anything like other activities that you like to do?
yeah, I used to bowl, but I just
Okay.
kind of stopped because of the pain. So, but I did like doing that.
Okay. All right. I think that is everything that I needed. So what would you say your goals are for therapy?
Just getting back to being able to bowl, maybe, or playing with my kids.
Okay. Okay. So do you have any other questions for me?
I don't think so.
Okay. If you do come up with anything, you can call the and then we'll go up there now and schedule you and get you some therapy sessions.
Okay, perfect.
All right. Thank you for your time.
Yeah, thank you.
10:10.